What are signet ring cells in diffuse stomach cancer? Imagine looking at a tiny microscopic world where some cancer cells have a very distinctive shape. In diffuse stomach cancer, especially a type called signet ring cell carcinoma, these cells are quite unique. They get their name because, under a microscope, they look like tiny signet rings. This is because each cell contains a large amount of mucin, a mucus-like substance, inside the cytoplasm. The mucin pushes the nucleus to the edge of the cell, creating a ring shape with a clear center, much like a signet ring with a seal or emblem. In the context of stomach cancer, there are two main types, intestinal and diffuse. The diffuse type, which includes signet ring cell carcinoma, tends to spread more evenly throughout the stomach wall. Unlike the intestinal type, which forms gland-like structures, the diffuse type with signet ring cells does not form organized glands. Instead, these cells are poorly cohesive, meaning they don't stick together well. They spread as individual cells or small clusters, infiltrating the stomach wall in a way that can cause thickening and rigidity. This infiltration can sometimes lead to a condition called linitis plastica, where the stomach becomes stiff and less flexible. Signet ring cell carcinoma is considered highly aggressive. The cells are poorly differentiated, meaning they look very different from normal stomach cells, and they tend to invade nearby tissues and lymph nodes early. They also produce a lot of mucin inside the cells, which contributes to their distinctive appearance. Because of their aggressive nature, this type of stomach cancer often responds less favorably to standard treatments like chemotherapy and radiotherapy compared to other types. The presence of signet ring cells is a key feature that pathologists look for when diagnosing this subtype. According to the World Health Organization, more than half of the tumor cells need to show this signet ring shape for a diagnosis of signet ring cell carcinoma. On a molecular level, some cases are linked to mutations in the gene called CDH1, which encodes a protein called E-cadherin. This protein helps cells stick together, and when it is lost or not functioning properly, the cells become more poorly cohesive and invasive. Clinically, patients with diffuse stomach cancer that contains signet ring cells often face a worse prognosis because of how quickly and extensively the cancer spreads. Early detection can be challenging because the cancer infiltrates the stomach while diffusely without forming a clear mass. However, if caught early, especially with advances in endoscopic techniques, the outlook can improve. It is important to remember that every individual case is different, and treatment options depend on many factors. In summary, signet ring cells are a special type of cancer cell found in a more aggressive form of stomach cancer. Their unique shape, caused by mucin pushing the nucleus to the side, helps doctors identify this subtype. Recognizing these cells is crucial because they signal a need for careful management and highlight the importance of early diagnosis. Always consult healthcare professionals for personalized advice and treatment options.